Okay, Bismillahirrahmanirrahim. Assalamualaikum and very good morning to our beloved lecturer, Dr. Hana Sabri, and to all my friends. Now we're going to proceed our presentation for my group, which is anxiety disorder and chemical dependency. Before that, I would like to introduce our members team, which is myself, Muhammad Firdaus bin Abu Talib as a first presenter, followed by Ahmad Fatihi bin Makhtar, and last but not least, Rosmawati binti Mohidin. And this is the client demography, which is his name known as Mr. W, age is 25 years old. He's a Malay male, a Muslim and single. His highest level of education in degree, currently treatment placed at AADK facility. So I will sharing with you about the study case of this presentation, which is Mr. W is 35 years old, single male who was referred for treatment by his rehab officer. Mr. W is currently unemployed and live with his friends in a different location each day because his relationship with his family deteriorated due to addiction. He is no longer welcome in the family house. According to Mr. W, he is not homeless. Mr. W stated that he has been stuck in addiction problem by using marijuana from age 15, but it is not his drug of choice any longer. He was introduced to heroin by his best friend at 20 years old of age during stressful times in undergraduate school. After 3 years later, regularly he drank alcohol together with his friend and at pub or friend's house. He states that his parents and two sisters are aware of his addiction problems and do not support him at all. However, his grandmother understand him more than anyone and support him financially in order to to prevent him from stealing. And this is problem statement of this case, whereby Mr. W present for opioid and alcohol detoxification and rehabilitation, no past medical history or any hospitalization for medical condition. He ever found unconscious by his mother in August 2018 and was hospitalized at hospital due to a heroin overdose. He left the hospital against medical advice after 2 days of admission, and he also denies any surgical history. So, this is the psychiatric history of this case, which is Mr. W reports that he has struggled with severe anxiety from an early adolescent age 12 before involved in drug problems yet. He stated that he cannot remember the time when he was free of anxiety without using some kinds of drugs. He said marijuana, opiate, and alcohol can help him to reduce the symptoms of anxiety. According to the client, he was never hospitalized for anxiety. However, he stated that he did have a suicidal ideation in the past, but not suicidal attempts. He denies any history of self-inflicted cuts or injuries, and he has been prescribed benzodiazepines, which is a Xanax medication for anxiety, but stopped taking medication 2 years ago. Currently, he is not under either psychologist or psychiatrist care and does not take any psychiatric medication. So, this is a timeline history of this case, which is at 12 years old, he claimed that he was have a severe anxiety, and at 15 years old, he first take a drug which is marijuana. At 20 years old, he take heroin. Introduced by his best friend, and at 23 years old he takes alcohol, and At the same time, he stopped the prescribed Xanax, and now he applied the treatment rehab center for the rehabilitation and treatment for his illness. According to patient, the main reason for his seeking medical attention is to avoid going to jail. The patient has a history of law violations and has been monitored by a rehab officer once a week. Rehab officer work with the patient and his family to arrange the recovery treatment program instead of jail. The patient voluntarily agreed to be evaluated for admission to the outpatient treatment facility. So next, I will pass to Fatihi for the sharing about the assessment of this case. And thank you very much for your attention and welcome, Fatihi.
Thank you, Mr. Firdaus. Assalamualaikum and very good morning to everyone. I will focus on diagnosis and pharmacological approach. In terms of opioid assessment and diagnosis, client start opioid at 20 years old, currently under treatment at rehab facility. Currently, client needs larger amount of opioid, persistent desire and unsuccessful effort to cut down. Client have craving, tolerant withdrawal symptom. Client continue opiate use even having persistent or recurrent problem. Recurrent opiate use in situation in which it is physically hazardous. Client also continue opiate use despite knowledge of having a persistent recurrent physical and psychological problem. So, based on the criteria of this client, he has meet of the DSM-5 criteria of opioid use disorder within a year. So the primary diagnosis for this case F11.20 opioid use disorder severe in a controlled environment. Okay. Secondly, about the mental health issue, this client also have anxiety. So in terms of anxiety assessment and diagnosis, client already diagnosed severe generalized anxiety disorder (GAD) at 12 years old before he involved in drug problem. Unfortunately, he defaulted treatment last 2 years. Currently, client has excessive anxiety and worry with occurring more days than not for more than 6 months. And client also have difficulty to control the worry. In terms of diagnostic criteria, his anxiety and worry are associated with physical impairment such as restlessness, being easily fatigued, difficulty concentrating and mind going blank, irritability, muscle tension, sleep disturbance. So right now, his anxiety, worry, and physical symptom cause significant impairment in social, occupational, and his life. Okay. So the diagnosis for anxiety, he has excessive anxiety and worry associated with more than three physical symptoms, more than 6 months. So secondary diagnosis in this for this case is 41.1 F41.1 generalized anxiety disorder. Okay. In terms of alcohol assessment, a client start alcohol at 23 years old, currently under rehab at facility, at the treatment facility. And client said he just used alcohol for recreational use at pub and friend home. Client also claimed no withdrawal and dependent symptom. Okay. In terms of pharmacological approach, for opioid use disorder, first we must assess client by using alcohol, smoking, and substance involvement screen test (ASIS) to measure the severity of addiction problem. One of the option to cope his client dependence problem for opioid, we can use harm reduction program by methadone maintenance treatment, for opioid dependence problem. Okay. In terms of anxiety, this client have a generalized anxiety disorder. First, we must observe and describe client current state of mind by using mental status examination (MSE), and we must refer to psychiatric for continuing his follow-up and treatment. In terms of severity level of GAD, generalized anxiety disorder, we can use GAD scale 7, iaitu generalized anxiety disorder scale 7, because GAD scale 7 use DSM-5 criteria for GAD to identify probable cases of GAD and measure anxiety symptom severity. So we can determine and we can classify the severity of symptoms in the case of anxiety at the minimal, mild, moderate, or severe anxiety. Okay. In terms of prognosis, client attended voluntarily at a rehabilitation center for detoxification and treatment. Currently, client show his readiness to change. So, based on TTM of change, trans-theoretical model of change, make client at level of contemplation. So, integrated approach in terms of pharmacological, psychotherapy, and psychosocial must be implemented to maximize the effectiveness of treatment. So, inshallah, client has good prognosis to change with integrated approach and treatment. So, in order to know more in depth about the psychotherapy and psychosocial, I invite Puan Rosma to continue our presentation. Thank you. That's all. Assalamualaikum.
Okay, Assalamualaikum warahmatullahi wabarakatuh, and very good morning to my beloved lecturer and to all my fellow friends. Thank you Mr. Fatih and Mr. Firauz for our group presentation. So my name is Rosmawati binti Mohidin. I want to continue the next presentation, focus on the treatment and plan and intervention for dual diagnosis, and focus for the anxiety disorder and drug addiction. Therefore, instead of treating anxiety disorder and substance use disorder, is independent condition treatment of both unified and integrated condition is encouraged. According to case study, we look at the psychosocial treatment is suitable for the client. We have some components focus on their treatment. The client must be following the integrated model of treatment, focus on mental health and substance use disorder at the same time, at the Tampoi Rehabilitation Center conducted by AADK. Focus on psychosocial treatment. So client should must following the CBT or cognitive behavioral therapy. Focus on multidimensional family therapy, individual therapy, and group therapy. The client need to follow a peer support group, focus on alcoholic anonymous and narcotic anonymous, focus on spirituality and religion. Commonly, AA or NA is a module conducted by in overseas, but in Malaysia, in rehabilitation center, in AADK or NGO like Pengasih, we also do the therapeutic community or we call TC. Client also must follow 12-step program, focus on recovery process. So the 12-step is a program conducted by PRS in AADK. The client should follow this program. And the next one is client must follow interpersonal therapy. They focus on individuals' relationship and improving communication pattern. We can focus on treatment in anxiety disorder. And the last one is the AMT program is under harm reduction program by KKM and collaboration with AADK. Methadone is focused on inpatient detoxification, drug-free residence, and outpatient therapy, also community therapy. That's all about psychosocial treatment. In the next, we look at the relevant ethical and legal consideration. According the case study, the client now under the treatment of the rehabilitation center. He is a volunteer client in section 83A Akta Penagih Dadah Rawatan dan Pemulihan 1983 Pindaan 1998. And the next one is additional treatment needs. The client should participate in social support group from government, AADK or NGO when he comes out from a rehabilitation center to improve their ability, skill and self-esteem. The most important is to avoid relapse. Okay, and the last part from the case study, so look at the evidence to determine the outcome. Okay, focus on anxiety disorder. BEC is a scale or a self-report measure on anxiety. And the focus on drug addiction, OTI, or we call the opiate treatment index, as a comprehensive evaluation tools and ASIS is can identify a range of problem associated with substance use, including acute intoxication, regular use, dependence or high risk use, and injecting behavior. And focus at the alcohol addiction. So we must use the instrument, clinical institute withdrawal assessment of alcohol scale, or we call CHIWA, and the Michigan alcohol screening test, or we call MAST. Okay, that's all about the study case, and the conclusion is client now focus on their treatment addiction at the rehabilitation center. If get the chance or suggest from psychiatry, client also can follow their treatment at the Tampoi Rehabilitation Center. After the end of the treatment, client should be continue in their treatment for addiction in AADK daerah. And the last, client also must take the medical treatment focus on anxiety disorder. Thank you from our group. See you again.